Good evening and welcome everyone. Thank you for joining the Alfred Health Intern Information Session. My name is Amy Tran and I'm a recruitment specialist in the Medical Workforce Unit. I'd first like to begin with an acknowledgement of country. Alfred Health respectfully acknowledges the traditional custodians of this land, the people of the Kulin Nations. We pay our respect to the elders past and present. We acknowledge and uphold their continuing connection to land, skies and waterways. Before we commence, I'd like to provide a summary of what you can expect from this session. We'll start with a welcome from our Chief Medical Officer. You will then hear about what we can offer you for your internship, then touch on the national framework. Following this, we have a number of presenters who will share information on career pathways, rotations offered, education and training opportunities. You'll also hear first-hand experiences from our current and previous interns who have completed the internship at Alfred Health. Now, following the presentations, you'll have the opportunity to join a virtual discussion where you'll be able to ask consultants and registrars specific questions related to the career pathway that you're interested in. You have been sent the link for this, but we'll also post the links in the chat so that you can visit different or multiple sessions if you have an interest in more than one specialty. I'll now introduce our Chief Medical Officer, Dr. Tony Kambarakis.
Thanks very much, Amy, and good evening, everyone. Welcome to our information evening. It's my very great pleasure to welcome you all and to kick proceedings off. Firstly, a little bit about Alfred Health. Alfred Health is one of Australia's leading healthcare services, and we have a dual role. We care for more than 770,000 locals who live in Melbourne's inner south region, but we also have a statewide role in providing health services for all Victorians and also from interstate experiencing the most acute and complex conditions through our 18 statewide services. We have 3 main hospital campuses, the Alfred, Caulfield and Sandringham, as well as numerous community-based clinics and Melbourne Sexual Health Centre, which provide life-saving treatment specialists and rehab services through to accessible local health care. And, you know, across our health services, we care for a wide range of people from all range groups. So, and our purpose is to improve the lives of our patients and their families, our communities and humanity. One thing I will, if we can just go back for a moment, just to let you all know that we're embarking on a partnership with Peninsula Health, Bass Coast Health, Kui Rup and South Gippsland South to undergo a merger. It's commencing from the start of next year, which will also expand our capacity to provide care for the community. Thank you. Next slide. So in the last year, we've had over 120,000 emergency presentations, nearly 12,000 planned surgeries performed from the waiting list. We've got over 650 clinical trials open. We employ in excess of 11,000 staff, and we have had up to 20,000 ICU occupied bed. That should say bed days, not bed bays. We wish it were bed bays, but it is bed days. So we're a very busy health service. And the important things for you, thank you, we can go to the next slide, is that you will gain a wide variety of clinical experiences working with us. You'll also experience an excellent supervision and a very supportive culture, which will be evident from our presenters this evening. And there will also be many training opportunities. We have over 40 specialist training programs, and we hope to see that will actually expand as we embark on our partnership with our other hospitals in the coming years. So we're very well placed to provide excellent training opportunities and excellent supervision and a supportive culture. I'd now like to hand over to Dr. Mel Fitzgerald, who's our Director of Pre-Vocational Medical Education, to talk to you a little bit more about Alfred Health.
Thank you very much, Tony. So now, quite some time actually ago, I was sitting in your seat contemplating myself, where should I go for my own internship and why? Well, fast forward now many, many years, and I'm very pleased to say that I've been with Alfred Health since my internship, and now, as Tony mentioned, I'm here as a member of the medical education team as well as a Gen Med consultant. So my talk today will cover who we are, what we do, what does this mean for you, importantly, what we can do for you, and then a little bit about the new national framework as well. So as Tony mentioned, we are one of Australia's leading healthcare services, but I think the thing that's really important is not only do we have a focus on the safety and well-being of patients, but the same focus and care is given to that of staff. We know that you as our future doctors in training are a vital component to enable us to continue to deliver that really high quality patient care. And this is across those different sites as mentioned by Tony. So the Alfred Health Campus has most of our acute care with ICU, the trauma centre and ED, as well as the majority of our specialist services. Sandringham Hospital has general medicine, general surgery, as well as ED providing paediatric opportunities. And there's also obstetrics and gynaecology there provided by Monash Health. At Caulfield, we have our subacute hospital with aged care, rehabilitation and ABI, as well as the Melbourne Sexual Health Clinic, and then our recently opened Paula Fox Melanoma and Cancer Centre. Thank you. But what does this actually, what do we do there? So I don't expect you to look at this list or be able to read it. It's just showing you that we have the most comprehensive range of adult specialist medical and surgical services in Victoria. So we have the National Service for Australia for Paediatric Lung Transplant, and then multiple up to 18 at the moment statewide services, so providing care to patients across Victoria, as well as many other quaternary, tertiary and specialist healthcare services. Next slide, please. Because the real question then is, what does actually this mean for you and embarking on your junior medical career? So it means that you've got really wonderful, exciting opportunities to learn from world experts, and you can gain exposure to amazing new advances in medicine and get really exciting career opportunities that aren't available elsewhere, as well as at the same time creating a really wonderful foundation for your future career, whichever area you end up choosing. So there's world firsts such as in the treatment and research with melanoma. There's lots of new epilepsy treatments, as well as artificial heart trials, alternative to a transplant, heart in a box, all these really amazing things that you can get exposure here to at Alfred Health. And so, again, importantly, what can we do then for you? So I've asked previous interns over the last few years, and there's always the consistent themes that emerge, and here are some comments as well. So firstly, we can provide a safe and supportive culture with a focus on your wellbeing. One intern has said, everyone that I've worked with has been patient, generous with their time, and what's the best for their patients. I haven't had anyone rude, and I think it's really reflective of the culture and the great camaraderie at Alfred Health. The consultants encourage you to ask questions all the time, and you're very much a part of the team. The other thing that I think sets us apart is outstanding supervision. So 100% of your shifts, you have a great supervision, whether that's the resident, the junior or senior registrar, the fellows or your consultants. In addition to this, there's clinical supervisors, term supervisors, your supervisor of intern training, who you'll meet shortly, Dr. Laura Scott. There's myself as the Director of Pre-Vocational Medical Education. Lila Rotstein is our Director of Clinical Training, and then Anna Corrin as well as our Director of Medical Services. So you're really well supported across the hospital in many different levels. Another thing that I really enjoyed in one of the comments was when a particular intern felt stressed, they had support available, but when they felt confident to push themselves and up skills, they could, knowing that no matter what, they had help readily available. Your internship will be a huge year of growth, and you always want to work within your scope of practice. However, you also want to learn. And so having that support structure around you to enable you to do that, hopefully by the end of your year, you'll be astounded at all of the new information and skills that you've learned over the course of your internship. We also have unparalleled clinical exposure, as mentioned. So you get to experience some of the most unique areas in medicine as an intern. And with working with medical workforce, how you preference your rotations means you actually get to see things such as lung transplant, radiology, trauma and acute psychiatry. We could also provide countless education opportunities, which I'm obviously quite passionate about. So intern teaching is weekly, it's paid and protected, and topics are relevant and engaging. We also seek feedback every single session to ensure that the education delivered is as best it can be and really helpful for your clinical practice and your career. In addition, we also have a HMO education program weekly that you can attend, and there's also unit-specific education, and everyone's always very strongly encouraged to attend. Specifically, as mentioned, the intern education at Wednesday lunchtime is compulsory from 1 till 2, and lunch is provided in person at the Alfred. If you are off-site at Sandringham Hospital or Caulfield Hospital, there is also in-person education with lunch provided there, and you can also log on remotely to view the Alfred sessions, and everything is recorded and available on Flex, which is our learning management exchange system. The way we map our curriculum is based on both the PMCB curriculum and the Alfred Health curriculum to ensure you get that really great set of foundation. And it's provided by different consultants and fellows with a mixture of lectures and practical skill sessions. We're also very proud of the professional development opportunities we provide, including leadership, communication, deteriorating patient, suture masters classes, abdominal laparoscopic workshops, and then family meeting shops. And particularly it's the communication and deteriorating patient workshops that get really amazing feedback, and they make your life on the ward so much easier when dealing with sick patients or met calls, and then challenging conversations that you may have with patients and family. As mentioned, there's also amazing research opportunities in numerous areas. The other thing that we can do for you is help with your career progression. So there's other speakers today that will discuss more about their specific specialty area, but we have excellent rates of getting our doctors in training onto their specialty vocational programs. The physician program every year far exceeds the national average pass result for both the clinical and written exam. We also have an extensive pre-vocational surgical program with weekly education, assigned consultant subspecialty supervisors to help you get on to the program, look at your CV, provide interview reference support, as well as mentorship, additional surgical skill workshops, exam support, and there's a career handbook to help with the process to make it more transparent. There's also a specific critical care education pathway and lots of simulation and clinical skills available. And importantly, many of you may also not know what you want to do. I certainly didn't at this stage of my career, and that's where we can come to help you. And so one of the other quotes was that the medical education unit and medical workforce unit are so approachable and involved, and it makes the transition from a medical student to intern much easier. And the one-on-one career chats are really helpful in deciding what training pathway you'd like to choose for your career. Next slide, please. Thank you. In addition, we also have our Alfred Resident Doctors Society. So that is made for our junior doctors, run by our junior doctors. It's excellent social and networking opportunities, and they provide weekly lunch on Fridays, as well as education and different social events. We also meet with them as well to ensure that we're getting really good on-the-ground feedback for our JMS to ensure we're supporting you all as best as possible. And lastly, I'll just touch on the National Framework for Pre-Vocational Medical Trainees. So this was new in 2024. It is now a 2-year foundational program for PGY1 and PGY2. So no longer do you have to do certain rotations, but it's more about clinical experiences over a longitudinal 2-year period. And in the purple there, you can see the A, B, C, D. So they're the different clinical experiences you have to achieve across each year. So undifferentiated illness and patient care, chronic illness, acute and critical illness, and then perioperative medicine. At the start of each rotation, you'll have a beginning of term discussion with orientation, and that's to set the goal so you know what you want to achieve from that rotation. You'll then also have a mid and end of term assessment, and this is all competency based now, no longer time based. And this is a really great opportunity to get that feedback to say, hey, this is what I want to do well, and I do well, but I keep doing, and then this is what I need to continue to work on. So you've got that constant support going through your foundational years. Next year, there'll also be entrustable professional activities, which are just simple work-based assessments of what you do normally on the ward, such as prescribing an antibiotic. It'll just be an opportunity for feedback and then just make sure you're training and getting to those goals. And this will all go on to an e-portfolio called Clinical Learning Australia. The other thing unique to Alfred Health is that we're able to offer in your second PGY2 year both successful completion of the national framework and getting the certificate, as well as concurrently your first year of your basic physician trainee if you choose. Some people are unsure that early on if they do want to do physician training, and it's a really great opportunity to do both, so you're not disadvantaged in any way. And our job is to ensure that at the end of your first year, you've successfully got your registration with AHPRA, and at the end of your second year, you have got your successful completion certificate from the AMC and PMCB. So that's what we're here for. So you don't need to worry about it. You just need to worry about learning and being the best doctor that you can be. So finally, who should apply? So those that are eligible, that are dedicated to providing the highest quality of care to our patients, have a really great willingness to learn with a growth mindset, because you will learn a lot during your internship year. If you're a team player and if you think Alfred Health will help achieve your goals in successfully completing your internship, we look forward to welcoming many of you here next year. Thank you very much. And I'd now like to hand over to two of our current interns, and the first will be Nilesh speaking. Thanks very much.
Thanks for that introduction. Hi everyone, my name's Nilesh and I'm very excited to be talking to you about the intern experience. I remember when I was in your shoes last year, and it can be quite nerve-wracking but also very exciting. So we might jump into it with the next slide. So why Alfred Health? I studied at University of Wollongong, so I traded that beautiful coastline there for the cityscape on the right. I have to take a moment to shout out the Illawarra Hawks, 2025 champions as well. So you might ask why I'd make that change, and the reason is that photo below. My family is here. So I knew I was coming back to Melbourne, then I had to make a decision, which hospital in Melbourne would I like to work at? And the one that stood out head and shoulders above the others was the Alfred, of course. And that's mainly because it's a centre of excellence for research, but also I've heard the intern program, well, I did hear that the intern program was really well supported and was a great opportunity to do a lot of good learning. And so far that has absolutely been the case. So very happy with my decision. And you can see a photo of some smiling, smart junior doctors there and me. Just kidding. And I'll get us to move on to the next slide, please. So some quick tips about getting your head around the junior doctor life. You're definitely going to have a lot more responsibility. You're going to be fully part of the team and trusted not just by your team and your staff, but also by the community. So it's about upholding that trust. And so some tips on how to prepare. I'd say focus on professionalism, ensure you're attending on time, you're dressed correctly. Those small things can go a long way. And I also think just doing some reflection that we should do throughout our careers, but certainly at the start, thinking about your strengths and weaknesses and how that's going to work for you next year. Some tips for right now. I think you should do as many procedures as you can with the supervision you get as a med student, just because it's fantastic. You still get that as an intern, but it's good to be ahead of the 8 ball, if you like. And I think it's really good to watch your interns closely at the moment. How are they prioritising, delegating and communicating? What sort of things can you take on board for next year? And certainly paying attention to shortcuts will pay dividends for you next year, so definitely do that. General advice, I think you should ask if you have any questions. All the senior medical doctors have been really lovely throughout my time so far, and I've always asked and there's never been an issue. So definitely make sure you do that. And just be the person you want to work with. Learning names is really important. Make sure, don't say you're bad at names. So it's really nice if you can learn everyone's name that's in your team and around you. Move on to the next slide. So the roller coaster so far, I started in the emergency department, which was very acute. Really enjoyed my time there. Some of the benefits of that is there's shift work, it's 4 days a week and no nights, which is really amazing when you're just getting your head around things. It's really great clinically minded work at all times, and the procedures opportunities there are really fantastic. The team atmosphere is really great. All the consultants, registrars and allied health, everyone is really keen to get you involved, and they feed back on the energy, and it's a really great team atmosphere. Some of the challenges are it's quite a large unit and it has the trauma unit as well, so it's a bit more difficult to experience the higher acuity presentations, but I certainly experienced quite a few. So if you're enthusiastic, that can certainly happen for you. And shift work can be a bit hard if you're getting used to it like I was. So now I'm in Bethlehem Palliative Care, which isn't as acute, but is still a really great experience. I'm seeing some very rare presentations like MND and Huntington's, which is really fantastic because it's things I wouldn't see normally. Some of the challenges are it's more of a ward-based job, so job prioritization. There's also some confronting discussions and situations, but overall it's been a really great experience. And so just finally, I just want to say good luck to you guys. Some of the things I wish I knew before I was starting is that we're all human. It's demanding, but it's certainly not impossible. You guys are all ready for this. Many have done it before you, many will do it after, and make sure you prepare for the traffic in Melbourne. I was not ready for it, so make sure you're leaving nice and early. And wherever you end up will be, and I hope it's the Alfred, and you'll be making a wise choice, will be the start of a great new adventure for you. So all the best, guys. Good luck. I'll now be handing over to my colleague, Laura.
Thanks, Nilesh. That's a great presentation. I think that represents intern year so far very well. So thanks for having me. My name's Laura. I'm originally from Newcastle, New South Wales. I came down to Melbourne for med school and be talking to you a bit about my experience. So picture this. It's day one of being a real doctor. Welcome to trauma. No, I mean welcome to the Alfred trauma team. You've got 38 patients between you, your reg, and the consultant. It's week one, and a consultant asks you to direct your family to the morgue. You've never been to the morgue. Now, I know what you're all thinking. I heard the same rumours about the Alfred. But after 4 months of deep ends as a fresh junior doctor, I can safely say that the Alfred has provided amazing support, engaging teaching, and a team environment that makes all the discharge summaries worth it. From paid overtime and support from seniors, I'm so glad that I came to the Alfred. Now, we're very blessed in Victoria to have a variety of health services to choose from. And with the transition to the ballot system, all your attention can now be diverted to learning as much as you can about the health services, their values and what they offer for you. So here are some reasons to come to Alfred Health from an insider perspective that you may not have heard before. Straight up, the pharmacists. Medications can be tough to learn and intimidating as a new intern because they carry feasible risk attached to the decisions that you make. The Alfred pharmacists are like none other. They help you with your scripts, even do them for you at times, which can take a lot of pressure off. But most importantly, you learn the medication doses safely and accurately, which is an absolute game changer. And you'll find that you remember them better as well. Despite the national framework shake-up, there's also a variety of rotations, which offers exposure to many aspects of medicine. Starting my medical career in trauma was daunting. I did a lot of paperwork, as expected, but being included in major shock traumas and experiencing the peak of critical care resus was a career highlight so far. Thirdly, education is a priority. If we can just go back one slide, that'd be grand. The medical education team are very supportive of protected teaching, as has been mentioned so far, ensuring that team modifications are made to facilitate your attendance as well. And there are also established set training study groups and streamed HMO teaching that you can attend if you're free. The consultants have also been approachable and supportive. As a junior, I felt valued and respected, and senior staff actually go out of their way to help you achieve your learning goals. One of mine was to go to the helipad. And thus far, I've also experienced transparent access to research opportunities. It's really easy to ask to get involved in projects. Don't be scared of pages either. It's actually fun to have something retro hooked onto your scrubs, and it can be helpful in teaching you how to prioritise your tasks as an intern. So on top of that, there are some simple things that actually make a difference to your workday. The Alfred is surrounded by parks, which makes for easy access to green spaces for a lunch break or before and after work. There's a newly renovated cafe area with an open courtyard, which makes for an aesthetic, clean ambiance. The doctor's residence is also newly renovated and has a rooftop with an outdoor seating area and views over the city and parks. That was great for me on trauma. It helped me forget all the chaos of the wards. The bike lockers are amazing, with showers and towels provided. Car parking is $12 a day, which makes your commuting options really easy. And of course, alternate food options are within a 2-minute walk away. And the late night options include Nando's, 7-Eleven and IGA. Coming to the Alfred with a deep, big end for me. I didn't know anyone and I'd never set foot inside the hospital. I was worried it would be chokingly competitive and there was a certain type that went there. But since day one, I felt welcomed, included, and have built new amazing friendships and experiences. And if you feel like that you might not fit in, that you might be exactly what is needed. So I urge you to think about applying to the Alfred. And some final tips before starting next year. Enjoy the ride and try not to panic. Everything will fall into place, and the parts of internship that are unexpected or hard will be a great learning opportunity and will teach you about yourself. So embrace the unknown. Enjoy your break. Spend time with your family and friends doing things you've always wanted to do. And one sneaky study tip. Practice your differential lists and management plans. It will stand you in really good stead to have the practice under your belt, especially in the emergency department. I wish you all the best for the rest of your year and the selection process, and I hope to see you at the Alfred next year. Thank you so much, and I'd like to now introduce our amazing Supervisor of Intern Training, Dr. Laura Scott.
Thank you, Laura. We'll see you back in the ED next week. Good evening, everyone, and it's a great honour and privilege to be here in the role that I am as Supervisor of Intern Training for Alfred Health. I'm one of the emergency physicians as well, and along with the medical workforce, medical education team and the unit intern supervisors, it's my great responsibility to look after you all as you transition to becoming a doctor. And you know, it's a really important time in your life and career, and you know, Alfred Health is full of opportunity, and we'd strongly encourage you to think about choosing us and as the health service that you want to come and work for. What we'll cover in the next few minutes is just a brief overview of the intern and HMO medical education, which has already sort of been covered already, and then I've got the task of talking to you about health and well-being. And I just want to flag that there will be some distressing themes mentioned, so if you're in a position where you're not really able to listen to that, I will give you a warning. If you want to mute, you know, silence me, you can, but it's just in the spirit of having a real conversation with you all in terms of preparing you as best as possible for what you can expect becoming a doctor. Next slide, please. Thank you. So our medical education team, you've met a few of them already. Anna Corrin is our Director of Medical Services, and Layla Rotstein, our Director of Clinical Training, and Mel Fitzgerald are all heavily involved in looking after you and ensuring that our academic processes and structures are there to give you the best possible chance of success. We work very closely with the medical workforce team, ensuring your rosters are fair and safe and, you know, help you juggle your work and life, as well as providing, you know, service provision for the patients that we need to look after. And obviously the medical education team and officers, including Sarah Hill, Anthony and Sarah, who you will meet, you know, weekly at the education sessions and things. So we're a close-knit team. We work very closely together. Our doors are always open, and we really get to know all of you as the year goes on and support you as best as we can. The other thing, next slide, please, actually. Thank you. So moving on to sort of orientation. So you've chosen the Alfred, you've been allocated to us in the ballot, and you'll be starting with us in January. The first week at Alfred Health will be orientation, where we go through a structured and robust programme to welcome you to the health service, explaining our quirks and processes and policies around the EMR, the computer system, our values, our expectations, the opportunities afforded to you, and then the practical things, you know, like Laura's mentioned, where things are, tours of the hospital, tours of the department, and just really trying to give you the best possible start to set you up for success as you start intern year. Mel's mentioned about the national framework that's coming in, so we have to abide by that in terms of enabling you to have general registration at the end of intern year. And that, you know, really focuses on a broad breadth of general experience, which regardless of any specialty you want to go into is hugely important. And I place immense value on the basic fundamental principles that will set you up for the rest of your career, you know, to be excellent clinicians. And we really feel that we're able to provide that to all of our doctors that we currently have and have gone in the years before. Rotations wise, so on being allocated to us, you'll be sent an email by medical workforce with the options for lines of rotations that you can have, and there's a mix in that to ensure that you're getting that broad experience. And the one thing about the Alfred that I have loved, working, or Alfred Health, and love working there, is the breadth of cases and pathology and cases that we get to see. That, we're a regular hospital, we still see appendicitis, we still see pneumonia, we look after all of the regular stuff, but on top of that we get to be the state service for burns, trauma, ECMO, transplant, HIV, and neurosurgery, and so many more. So the opportunities that even just coming in through our doors provide to you as a doctor and a clinician are just immense. And you really feel part of that. We have high standards, we provide excellent patient care, and we strive to be the best. And it's really an environment that fosters that culture in terms of providing excellent patient care. As Mel said, the Intern Education Programme runs weekly. I've been attending quite a few sessions and have that opportunity to meet with you, and you for me if there's any issues. And we're really trying to work towards mapping that to the curriculum and making it really relevant for you and practical in terms of what you need during intern year. So we're open to feedback. We're always continuously trying to improve, and so far the sessions have been really well received. As Mel mentioned, the HMO education programme, which we're able to attend. Next slide, please. Mel's mentioned some of this as well about the Suturing Masterclass. We do have online learning modules, as all health services do, that are required for accreditation purposes, that will be expected to be completed in that orientation week. That's done through an online platform, and obviously everything will be explained to you around what the mandatory components are, but it's a huge part of professionalism. And to set the tone now, these are some of the things that just have to be completed as you become a doctor. Obviously, each unit you will learn something different, and will have its own educational programmes perhaps, and those that are at Sandringham and Caulfield will have the opportunity to work on the teams there. And we, as I said, we do seek regular feedback and want to hear from you around, because it's you guys that are on the intern journey. We want to make it as best and as relevant to you as we possibly can. Next slide, please. Thinking ahead, so as Mel said, we've got excellent rates of getting onto the training programs that you want, and certainly within the emergency department as well going forward in your training. I can speak to that. We've just had 100% exam results in our OSCE. So throughout training, regardless of what specialty you go into, you are going to be well supported to do the very best that you can in the least painful, hopefully, way as possible in terms of studying for your exams, which is, it's not easy. We have many research opportunities. We have a strong academic profile, with a lot of the units having individual academic centres, and that is, amazing to be part of. Got lots of teaching opportunities, courses you can go on, ultrasound skills you can develop. We really have our ducks in a row, I think, in terms of being able to provide patient care, and being a part of that team is, such a privilege. And I think, therefore, there's all the other things that you can take advantage of in terms of, learning and teaching. Next slide, please. And then, obviously, as I mentioned, we've got a lot of the specialties, estate services within our health service, and with the merger coming, and perhaps, we're not sure what it looks like exactly yet, but some of the other ones like paediatrics, we may have more exposure to as well. So there's a lot of opportunities for experiencing lots of different careers that you may want to pursue, and we can, link you in with those specialties and people to give you the best possible chance of being able to pursue that. Next slide, please. So moving on to the well-being aspect of it, and this isn't yoga and coffee and dogs in the park. This is about a sustainable, safe workplace that looks after you, because you are the ones that look after our patients. And as a unit, we are very passionate about that. It's not easy, and it's not always easy, to juggle this. At the end of the day, we do have to provide service provision for the patients that we look after, but it is high on our priority list. And again, we're open to feedback, and the culture that we have, is very safe, very supportive. And if you do experience anything other than that, it's definitely something that we want to hear about and would take action to review and fix. There's obviously individual things in terms of looking after your own well-being that we'd encourage. So having your own GP, having the healthcare that you require, thinking about shift work and how you're going to adapt to that. As well as how we roster you and work into the EBA, which is our legal requirements in terms of the workplace. Next slide, please. So I think we stand by what we say. We are a caring environment. We take pride in our trainees and their achievements, and we have a lot to be proud of. We look at individual units and utilise the feedback that you give us from end of rotations to take action. We've obviously got our internal and external support networks like our employee assistance programme, and within the Alfred we run an intern mentor programme, and we've got consultant mentors that you can utilise and meet and make connection with. And obviously you've got your unit intern supervisors, me as a supervisor of intern training, and the people that I mentioned on the second slide. Before we move on to the next one, this is the bit where I will talk about some distressing things. So if you do want to take a break, feel free to do so now. Next slide, please. I want to be honest with you though, the reality of the job can be tricky. A lot of you may not have experienced this depending on the clinical rotations that you've had, but behind every presenting complaint and case that we see is a person. And some of these people have hard times and come across vulnerable situations. And as a doctor, we are there to help and support and treat and look after them and care for them. And, that can take its toll. We see people, we look after people at the end of life and they may die within our care. We see people who've been physically assaulted, and we see a lot of violence and aggression from substance misuse, and our mental health population can be sometimes challenging to manage in their behaviours. People have poor health literacy, and you might find that challenging to understand and deal with, and the job can be hard. We look after a lot of patients. Laura mentioned about the trauma unit, so you're an integral part of that team and have a very important role to play, but it's important that we acknowledge that now and put these systems in place to make sure that we look after you and that you understand what's expected and the supports that are there available for you if you do come across things that you're not comfortable with, because your friends might be in finance or architecture or something, and they're not going to see the things that you're about to see next year. But it's not all bad. Next slide, please. With the reality of that comes immense privilege to be, an advocate for a patient and to support them and to make them better. And the vast majority of patients that we see do go home and do get better, and you make a real difference. There's a lot of job satisfaction in that. There's a lot of joy in it, in the connection that you make within the team and with your patients, and reward. You're highly professional. We're respected as a profession in the community, and we have, as we said, lots of support structures in place. We debrief cases. You'll join the intern cohort and make friends that you will have for life and throughout your training, and you'll look after one another as we will look after you, because that is what helps the culture of the hospital. We have, the cases are really interesting. You're going to develop. It's highly stimulating. There's a lot of educational opportunities available, simulation, ultrasound, research, as I've mentioned. And the reality of the job is going to be in any health service that you work for. So, we feel that we can offer you, hopefully, the greatest intern year, hopefully, that you can want. Next slide, please. That's just a copy of our wellbeing resource that we've got that is available to you, talking about the EAP. And I think that is the last slide from me. Thank you very much for listening, and I'll hand over to Amy to talk to you a little bit about rostering and the medical workforce.
Thank you, Laura. My name's Amy Murray-Brooks, and I'm the Operations Lead from the Medical Workforce Unit. So I'll be going through a brief overview with you today of the unit and what you can expect from our team should you be working at the Alfred in 2026. So we're made up of two main teams. So I'll primarily be talking to you about the operations team and our involvement in the intern experience at the Alfred. So we're responsible for your allocations of your rotations, your rosters, your leave, your online timesheets and your payroll. And then my colleague Amy Tran from our recruitment team, who started the session, will go through some recruitment and application information later on. So there's 5 of us in our operations team, and we all manage different portfolios. So throughout your internship, you'll be dealing with all of us at some point. The team are all extremely friendly and approachable. We pride ourselves in going above and beyond to assist our junior medical staff. We have an open door policy in our office and encourage you to visit our offices, but we also visit the on-site staff-only cafe each week to give out free coffee vouchers and to also answer any questions that you have. And we also regularly pop into intern teaching so we can be as accessible to you as possible. Moving on to the intern experience at the Alfred, we currently have 74 intern positions for next year, and throughout your internship you'll complete 5 rotations. So your contract will commence on the 5th of January 2026, and that's so you can attend our orientation week. So there are over 30 different rotations available, and these are based at the Alfred, Caulfield and Sandringham hospitals, as well as secondment opportunities at Bethlehem and Bass Coast hospitals. So 88% of our rotations are based at the Alfred, which is done so we can ensure you are close to all the support that Alfred offers throughout the majority of your internship here. Alfred provides many statewide services, thus providing rotations you'll only be able to access at the Alfred. These include trauma, lung transplant, and radiology. I'll now give you some information as to how the allocation of rotations work. So on the screen, you'll see an example of an intern matrix. So each year, medical workforce construct a matrix. It'll look something like what you can see. This matrix is constructed to ensure that you have a wide range of experiences within your intern year, as well as meeting the requirements for the national framework. So you receive a survey where you're asked to rank each line. So with 74 positions available, there is a lot to rank, but if you primarily focus on your top 15, we've had great success in ensuring interns receive a preference within their top 8. So if anyone's already thinking about, what to do beyond intern year, I've collated some information on the next 2 slides regarding our available rotations for PGY2 and PGY3 years. So while there will likely be changes in this space, this is an overview of how we anticipate the years will be structured in 2026 onwards. In 2026, for PGY2, we'll be offering 2 streams. So we're very excited, given our broad range of rotations, we'll be able to offer BPT1 in PGY2, as well as a general year. So for those choosing BPT1, there are excellent medical rotations available, which you can see on the screen, and that will enable you to start meeting your core training requirements. In the general year, we have a great range of specialty rotations such as anaesthetics, ICU, psychiatry, radiation oncology, ophthalmology, and ENT. So the allocation of the rotations we anticipate will be similar to how it works in intern year, constructing a matrix for each of these pathways, each of these positions, and you'll be given the opportunity to rank these in order of your most preferred. So 2026 is the first year that we're going to offer these, as I mentioned. So the structure of how the years look may evolve slightly, but as we continue to grow, we expect to be able to add even more highly sought after rotations to our pool. Moving over to the PGY3 year, successful applicants in the critical care stream will have the opportunity to undertake 6 months of the year in anaesthetics or ICU. Well, over in the surgical stream, we offer unaccredited registrar opportunities at our rural secondment sites in general surgery and orthopaedics. So as you can see, our PGY2 and PGY3 years offer a great range of rotations across all of our streams. And if you'd like to refer back to the available rotations at any point, they're available on our website. So now I'll give you an overview of what you can expect from our rosters at the Alfred. So prior to the release of the rosters, the team reach out to see if you have any requests you would like us to consider. And while these are not always possible, we will always do our best to consider them. Our rosters are published 4 weeks prior to the commencement of each term on Microsoft Teams, and at that point you'll receive an email with the roster information and important administrative information from the operations specialist who will be your contact for the upcoming term. A typical week in the life of an intern will vary depending on your rotation, so it's a great opportunity for you to experience a number of different shift patterns. So on the next slide I have some examples of what you can expect. Maybe not on that one, but the one before that. Okay, that's fine. I can explain what they are to you. So in the emergency department, you would expect to work a mix of days and evenings, 1 and 2 weekends, and a standard 76-hour fortnight. In general surgery, you can expect to work a Monday to Friday roster with a 1 in 5 weekend commitment with some rostered overtime. And other units will have different roster patterns such as 7 days on and 7 days off rosters with the occasional weekend on call. Now to the next slide, which we briefly saw before, which is exciting, the annual leave. So you get 5 weeks of annual leave per the year, and that's requested throughout the rotation preference process. So we build in the annual leave to the rotation lines, and then you can preference that along with your rotation. So we've been able in the last couple of years to make our approach to leave more flexible, and that gives you the opportunity to take the majority of your leave throughout the year. But we also have the option still available for you to take 2 weeks throughout the year, as well as 3 weeks at the end of the year. That is all from me today. Thank you so much for your time, and I hope I've given you a clear overview of what you can expect if you join us at the Alfred next year. And I'd now like to pass on to Dr. Benjamin Townley, one of our current HMOs.
Hi everyone, my name's Ben, and I'm a current PGY2 doing my first year of basic physicians training. I've primarily been asked to speak because I've, recently completed my intern year, as in the end of last year, and I've been asked to reflect on my experience as a whole. I realise we've got a bit of time pressure, so I'll try and make it punch in to the point. I don't know why I ended up with a bit of a Pokemon theme on my slides. Not sure entirely why, but I just thought it was a bit fun. So I know for you guys, going into internship can seem a bit daunting, and I realise it's easy to get swept up throughout the year in the workload, the pace, and the rush of the whole job. Next slide, please. But I promise you really don't need to worry. And I guess when I reflect on my experience of the year as a whole, previous slide, please. There's just a few things that stand out that I think are quite important to get out of it. And I wanted to, guys, relay them to you now, just to encourage you to keep them in mind throughout the year, so that at the end of the year you feel that you've made the most of your internship. Next slide, please. The first thing, and I'm aware it's said a lot, and I know I'm going to sound a bit like a broken record, but it's very true, which is to make the most of the support in internship year. So I'd really encourage you to ask for help when you need it and ask questions when you don't understand something. And I really think that asking these questions will be basically how you get the learning out of your year. If you don't ask questions, you're not really going to learn as much as someone who's actively asking all those questions. No one's going to begrudge you asking those questions as long as you kind of show that you're trying. And my tip for the year, would be to make sure that when you're asking these questions, you provide all the clinical background that's required, so that the senior doesn't need to kind of fire back lots of clarifying questions at you, and it just makes you look more put together and prepared if you've thought out the question beforehand. But even if you're not, don't let it stop you from asking questions anyway. The next tip I kind of thought when I was reflecting on my whole year of internship was really to reflect on the variety of experience that you get throughout the year. So internship and PGY2, next slide, thank you. These years are really the last times that you'll have such a generalised experience throughout your career, and I think it's really important in that time to, when you're going through each rotation, reflect on your interest in that rotation, the practicalities of that rotation, the content of it, and the lifestyle. Because I think doing it as part of the workforce can be quite different to doing it as a medical student. And it's important to start thinking about these things to plan your future going forward. I know that I think when I was in medical school, I had some sort of idea of what I wanted to do, but then in my internship year, I think that changed about 7 times. But I think that's a good thing, and I think it shows you kind of reevaluating your choices as you go through. My next tip would be that throughout your year, you should really focus. Next slide would be great. Thank you. Throughout your year, you should really focus on developing your critical thinking skills. I think probably the big difference from being a medical student to being at least a good doctor is these critical thinking skills, being able to think on your feet and thinking stuff through rationally. Or at least my experience in medical school, you could really get through if you kind of just studied and even learn a bit, and that would be enough. But a really good doctor is able to reflect and think critically. I think my tip for you guys going into internship was that if someone asks you to make a decision, just take a beat and kind of think, could there be poor outcomes if I don't do X? And that can be like as simple as going, could there be poor outcomes if I don't escalate this to my senior or my registrar? Or could there be poor outcomes if I don't go and examine this patient myself? But if you do that, I think that will set you in quite good stead. I think, though, the reason I'm here and the reason I'm talking to you guys and the reason you guys are attending this chat is basically to see why should you go to the Alfred. And shock horror, surprisingly, the Alfred is actually very good at supporting you in all these separate endeavours that I think are important for you to get out of internship. So the first thing that has been mentioned by many people, but the Alfred is really well supported. I think there's really well-designed teams in the Alfred. There's an expectation throughout Alfred and the whole culture that you always have appropriate escalation pathways and always have someone to go to if you need. And there's just a really culture of support. And I think people would probably say that about all the different hospitals, but the evidence of this in Alfred, I guess, that we can point to is the fact that Alfred's probably the only hospital in the state where you don't do nights as an intern. And I think that just shows how much Alfred is really trying to help that ease that transition through medical school into internship and then further. The next thing that Alfred does really well, especially compared to other health services, is they really invest a lot of effort into you and into supporting you throughout your whole career. I think from the outset, the Alfred is really thinking about your career trajectory. They're asking you questions about where you're considering going, not to lock you into anything, but to see what supports they can put in place to help you through that. And so I know they did that for my internship, and now that I'm doing my first year of BPT, I know I originally said that I was possibly interested in medical oncology, and so my current supervisor is a medical oncologist that kind of helps me through and helps guide some career decisions. And the final thing that Alfred does really well, and I know this can kind of come off a bit centre of excellence-y, but I think there are expectations of Alfred of high-level performance. I'd say almost all of the staff operate at a very high level, and there's an expectation that you try and do the same. And I think when you're learning from others that operate, that perform at a high level, and there's an expectation that you do that, you will perform at a high level. You'll kind of rise to the challenge, and there's support to make sure that you do that. That's most of what I want to say. Thank you guys for listening. I'll now hand over the microphone to Associate Professor Anne Powell, who's the Director of Physician Education, is going to talk about the medical pathway. Thanks.
Thank you so much. Thank you for having me on today to give the little spiel on physician training at the Alfred. There's a lot of misinformation that goes out there, so hopefully I'll be able to clarify that, particularly with the change in the framework and the impact that's had on physician training. So next one. So I think it's really important that Alfred Health has been very supportive in our push and liaising with the College of Physicians and the state government to allow people flexibility in their training. We're very keen on people that know what they want to do and they're prepared to keep going with their physician training from internship to allow entry in the PGY2 year. We're very fortunate with our mix that we're able to do that. And one of the reasons that we can do that is there's unfortunately for other people, we probably don't offer, we've never offered a more, general practice, obstetrician, paediatric type stream because we just haven't had that amount of rotations. So we really have always been very much a medical, surgical, critical care health service based on the rotations that we're able to offer in our PGY2 rotations. So this is sort of the overview of where you want to go. If you want to go physicians, you want to go for your internship, into your physician training, onto your advanced training, and then finally finishing it off with a fellowship or a PhD. So just next slide. So this is what I think is always interesting and comes into a lot of the questions I'm seeing on the Q&A. And that is that Yes, we absolutely support people that come to the Alfred thinking they might want to do one thing, as Ben said, but then maybe changing their mind. And we have a lot of our people that might divert off and go into general practice, paediatrics, dermatology, medical administration, psychiatry, and maybe decide they've actually changed their mind and want to go more into a critical care stream. So in any of our PGY2, PGY3 years, we'll often get people changing their mind, and we support that, and we encourage the rotation mix that will best support them in that area. To be honest with you, though, the vast majority of people that do enter our physician training program stay in our physician training program, and I'm pretty happy about that. We love our medicine, we love our teaching, and we're really proud of the fact that not only do we get them through a series of, transition from resident to registrars, we transition through 2 very high stakes exams, and right into their advanced training. And we're very successful at interview skills training and preparation with a research portfolio for them to be successful into their advanced training and onto consultancy. You can see here down the bottom that's all of the physician training type medical specialties that are on offer by the college, and we offer all of them. So that's sort of one thing that I love about the Alfred, is that there's so much career, planning and advice. Some of those with an asterisk you can enter via different pathways. So nuclear medicine, you can go via radiology, for example, or palliative care, you can go via general practice. But, these are all the pathways that are on offer. So we're super excited by our training program because we can pretty much offer it right through. So next slide. So one of the things we really love is that we've been working on our program for quite a few years, and Tony Kambarakis, who you heard earlier, is probably, cringes when we get on the phone with him. It's very much the Alfred mentality to keep push, push, push and trying to get the best out of everything. So we're super proud of the general aspects of it. We have advanced training support. We have research opportunities in area of interest. We, as Ben said, we link people in with the area that they might be interested in, so they've got that educational supervisor that can help guide them through the journey. In our PGY2 or BPT1 year, we have a medical emergencies program, clinical skills session, and overview of subspecialty medicine, really just making it that you're safe to manage a lot of the really exciting medicine that Alfred has, from cystic fibrosis to transplant to haemophilia to, all of the CAR T therapies that are coming out in haematology. It's just incredible medicine all the time. And as I said, we do work on BPT 1 year at really building up some of that research portfolio, because we do know that, whatever it is, the pluses and minuses, it does count for your AT applications. So we are always looking out for people to be successful in transitioning through at each stage of their training career. Next slide. Probably what most people have heard about, though, is, and as Mel alluded to, is that we do have a really lovely success rate with our training programs. We're very happy about that. We've put a lot of work into it. We have an entire online program for written, including 5 trial exams, large pool of questions. The hospital very kindly funds your 2 weeks conference leave to attend a written exam course, and we have really high rates of success. And that follows straight on in your BPT, as soon as you've got that halfway through. All of our trainees currently preparing, we've got 32 this year, preparing for their clinical exams, and we have a really high rate of that with dedicated training time on Wednesday afternoons. We're one of the only sites, I think, with patients being brought in from the community to assist in our training program, and dedicated educators that have actually done train the trainer at a physician education level. We've got 40 trained consultants at the Alfred that have trained themselves up for this, and this is unheard of at any other site. So we're super proud. It's a combination of our executive being very big advocates of education, because we know that if you're well trained, not only are the patient care outcomes better, but actually we've worked out that you're probably a bit weller, for want of poor grammar there, but we know that if you get those supports, you get the things you need to navigate these difficult high stakes exams. It just keeps you that little bit safer and a little bit happier, to be honest with you. So next slide. Ooh, hold on, go back one. I thought I had one more slide. So I think there was just a few questions online, and I'm just going to quickly answer them. Sorry, Fatima, I'm probably not meant to, but I'm going to. So the first one is, yes, absolutely, Alfred's an advocate for BPT1 entry at PGY2, but we're not mandating it. I think that's really important. So people that aren't quite sure yet and would like to do another generalist year and just finish their certificate in PGY2 year, we're absolutely supportive of that as well. But those that really know that they want to hammer through, we're absolutely supportive and we'll have a robust process. Yes, of course, we will be interviewing and looking, of our doctors that are within the Alfred Health Service. But the Alfred, because of the complexity of the medicine, I always call it the reverse pyramid. And that means that we often have more doctors the more advanced we are. So we always do tend to recruit into our BPT 1 or 2 pools, depending on how the numbers are going internally. So definitely, if you aren't allocated on the ballot to the Alfred and you're keen to come, please keep in touch because, we'd love to hear from you. And the other question I had, I think they were all of them. So I think, Mel talked about wellbeing. This is what we've done to try and support it in the physician sphere, to the extent where, as my midlife crisis, instead of getting a convertible BMW like one of my mates, I went and started a PhD in burnout in educators and our trainees. So who knows what happens at the Alfred. But without further ado, I look forward to meeting some of you in the chat session later. But I'm going to pass on to Dr. Eleanor Junkatoff to talk about the critical care and emergency medicine. Thank you so much.
Thank you, Anne. And yes, hello everyone. I'm Eleanor Junkatoff. I am the ED Deputy Director for Workforce and Education. And I am very pleased to be joining you tonight to talk about pathways in critical care medicine within your careers that you will be interested in learning about when you're considering Alfred Health as an option for your intern year. Next slide, please. And so really critical care pathways are for those who are really keen on becoming emergency physicians, intensivists and anaesthetists. And I'm here to tell you that all of those options are good choices if you were to choose Alfred Health. But I think that the base skills required for entering any of those critical care pathways are that you get a really broad experience in your intern year. And so the options available to you as an intern at Alfred Health are there for you to learn and develop those. And so really the point of your pre-vocational years at Alfred Health will be to get excellent experience and exposure, which, having listened to all of the talks tonight, you can be confident you would get by choosing Alfred Health. The opportunities for ongoing learning, which are all there. To develop your leadership skills, as a junior doctor, you will find that you become a leader, that you're suddenly in a position where people look to you for guidance in situations, and there is a lot of support for developing those skills and a lot of opportunities at Alfred Health. Your followership skills become really critical as well. We have, as people have spoken about earlier, big teams at the Alfred, and we work really closely together within our units and across our units to deliver really excellent patient care, which is the core guiding principle of how we work at Alfred Health. The really important things for you will be to build relationships in those early years. So during your emergency medicine terms, during your terms in other units, you will interact with the intensive care unit, you will interact with the anaesthetists, and you will be looking to sort of build your relationships, develop mentorship type relationships as you seek a pathway, and gathering your references as you go towards one of those critical care specialties if that is your choice. But also to expand your interests. There are so many opportunities in medicine, and the Alfred Health is a perfect place to experience the many different choices that people may look towards as they develop their career. Next slide, please. So you will have, I think, to summarise it, amazing opportunities to see and care for patients that you may not see anywhere else. And with the support of experts in these fields, leading, teaching and supporting you. And that has been my experience and great privilege over the last 10 to 15 years that I've been here. The Alfred Emergency Department, you will see incredibly complex patients in all parts of the emergency department. And that emergency department space is such a connection between the whole of the hospital and the community, which I think is really important no matter what your pathway in medicine becomes. Understanding how to support patients who you are discharging to the care of community services and general practitioners, and connecting with that part of the community, as well as connecting with the inpatient units and learning how they function, is really important. You will also in the second year have opportunities to work at Sandringham Emergency Department, where you will have access to experience in paediatrics and O&G, and many sort of small minor procedures that happen down in those emergency departments. It's a really incredible space to get your skills up. And we have the same consultants working across both emergency departments and the same registrars rotating between those two emergency departments. And so you'll have that opportunity to build relationships with both, with the emergency consultants and registrars, and even the nursing teams across both sites, which is quite unique. The intensive care unit, we have a huge intensive care unit and world leaders in many fields, and the Victorian ECMO service running out of our intensive care unit. And so if intensive care is your interest, there are incredible opportunities for connecting and developing your CV and relationships through the intensive care unit. We have an excellent anaesthetics department who functions to support our surgical specialty units, our ED, ICU and trauma services. And they have an incredibly successful education program as well. I attended their audit a couple of weeks ago, and I'm aware that they had a 100% success rate in their junior doctor exams as well. And I've added the trauma unit in there. I know that technically the trauma unit is a surgical unit, so I'm not stealing from other places, but they're very present within the critical care spaces within the emergency department, the ICU, and also throughout the hospital. And so I think it's important to talk about the critical care experiences you would have as working as an intern within the trauma unit. There's skills that you may not have exposure to in many other places, and they are also a truly multidisciplinary unit. Within their confines, they have emergency physicians, intensive care physicians and anaesthetists all working primarily together to support and round on the patients on the ward, and communicating directly with the trauma surgeons who support them as well. So I think if I were to say anything about the culture at Alfred Health, and I think that's really important, it's that we all work together as a whole hospital team to deliver the best possible patient care that we can. And as an intern with us, you would be critical in being a part of that team, and we would look forward to supporting and getting to know you as a part of that team as well. Next slide, please. So it was mentioned earlier on Amy's slide, I guess, that once you get to PGY3, you would then be looking at choosing directly to enter a critical care stream. And the options on offer there at that point in time would be anaesthetics options, ICU, emergency medicine, trauma, general medicine and relieving. And that is the point at which you would be looking to narrow down on your choice towards critical care. But those first couple of years, all of those rotations will be on offer, some of them only in PGY2. And beyond that, having a really good core experience within the hospital, I think, is critical to success in any critical care specialty. Next slide, please. I've said it over and over, but we're really proud of the fact that I truly believe we deliver exceptional patient care. And the fact that I have the privilege of working in that system, I find very wonderful. We are a team. We have strong relationships between our critical care disciplines. We also, I think, we really remember what it was like to be a junior doctor, or we try to to remember what it was like to be a junior doctor, and we are there to support you. We want you to ask questions. We want you to come to us. We want to be a whole team for the purposes of caring for our patients. And we are invested in your professional development and in your wellbeing. And we are very well supported by our executive and our senior leadership teams within the hospital, and by our medical workforce and education units, who do a fantastic job. And that is all from me, and I will pass on to Dr. Laura Blair-West, who will speak about psychiatry pathways.
Thank you, Eleanor. Good evening, everyone. It's such a thrill to be here tonight and speak about the psychiatry pathway at Alfred Health. My name is Laura Blair-West. I am the Principal Psychiatry Registrar at Alfred Health, and I'm looking forward to telling you a bit about my journey. Just over the next 8 minutes, I'll tell you a bit about my journey in psychiatry, and then bring it back to the pre-vocational training opportunities in psychiatry at the Alfred, and then on to psychiatry training at the Alfred and the sort of opportunities that are available in that setting. Next slide. So it's really exciting to be presenting to you all this evening. It doesn't feel like all that long ago that I was in your shoes thinking about where to head as an intern. I completed undergraduate medicine at Monash and did a BMed Sci in psychiatry during that time at the Monash Alfred Psychiatry Research Centre. And I was an Alfred intern in 2016, and it was during that year that I did an inpatient unit rotation with Alfred Psychiatry, and really felt determined from that point onwards to pursue psychiatry as my career. I went on after that to do a psychiatry HMO year, or an unaccredited psych registrar year, where I spent 6 months in the psychiatry inpatient unit and 6 months in one of our community clinics on St Kilda Road. And thereafter I've entered into my formal psychiatry training. I've done a whole range of rotations through Alfred Mental and Addiction Health, working on the inpatient unit in the community, doing child and adolescent psychiatry, and finding my niche in consultation liaison psychiatry, which is a subspecialty which is sort of where psychiatry meets medicine, and a really fascinating area to work in. I've also done elective work, including in forensic psychiatry at Melbourne Assessment Prison, and for the last 2 years I've been doing my advanced training in CL psychiatry, and I'm currently working in a mother-baby unit that's run by Alfred Health at Ramsay Clinic, Albert Road, so providing support to mothers dealing with postnatal mental health conditions. And during my training, I've also raised a young family. I've worked full-time, part-time, taken periods of leave, and been really impressed with the flexible and supportive environment that I've left and returned to time and again. And this year I've been working as the Principal Psychiatry Registrar for the service. Really great opportunity in terms of leadership and advocacy, as well as mentoring JMS. For me, psychiatry was an easy choice. It's diverse, dynamic, fascinating, but it's also very meaningful work, and we really, at Alfred Psychiatry in particular, pride ourselves on patient-centred and recovery-oriented care. It's very collaborative. We're a very strong multidisciplinary team, and we work best as a team. And of course, you know, there's such a growing need for psychiatrists, lots of funding, and plenty of work here, and even more moving forwards. Next slide. So thinking about pre-vocational training opportunities at Alfred Health, if you do start as an intern here and continue working thereafter, this is a very involved diagram of our kind of operational structure, but in recent years, just back to that other slide would be great. Thank you very much. We've really had a huge expansion in the sort of opportunities that we're able to offer to interns, medical HMOs and psychiatry-specific HMOs. So we've got junior medical staff working in the inpatient unit and community settings as previously, but we've also got opportunities in CL psychiatry with our crisis assessment and treatment team, in aged psychiatry, and on our women's mental health ward ward at Ramsay Clinic, Albert Road. And I guess some of the focus for pre-vocational doctors doing psychiatry rotations is increasing competence and confidence with your mental state examination and risk assessment, and building confidence in assessing and managing common psychiatric presentations. And delirium is a huge one for interns and medical HMOs in terms of managing that condition in your existing patient load. On to the next slide. So why do psychiatry training at Alfred Health? We are a really large service for psychiatry training. This year we have 66 junior medical staff, in addition to those that rotate through with us as interns and HMOs. As was indicated by that sort of organisational map, we've got a hugely diverse range of rotations, both on-site at the Alfred and at various locations off-site. We've also got very established advanced training programs in consultation liaison psychiatry and child and adolescent psychiatry. We really are a leader in terms of teaching program and exams preparation tutorials, and we do have a fantastic pass rate for our exams, which has been upheld year after year. And as mentioned, there's fantastic opportunities for availing oneself of leadership roles and also getting really involved in mentorship and peer support program. We're a very sort of close group and we have intermittent social activities throughout the year, so it's just a really lovely place to work if you've got a particular interest in mental health. I've just got here a kind of table that outlines the general trajectory for those pursuing psychiatry training. So once you're on the program, you do stage 1, which is a year of adult psychiatry core work in inpatient and community settings. Year 2 comprises sort of mandatory rotations in consultation liaison psychiatry and child and adolescent psychiatry. But there's, flexibility there for a couple of, I guess, elective rotations, and Alfred Psychiatry has always been very supportive in terms of allowing registrars to pick their own adventure in that respect. And stage 3, one can either continue on with a general adult psychiatry pathway or choose a specific advanced traineeship subspecialty area of interest. And over the final years of training, you'll do your summative assessments. So I think that might be my last slide, actually. So thank you so much for having me, and I'll hand over to Mr. Andrew Pekianathan to discuss the surgical pathway.
Thank you very much, and thank you very much for getting me to speak today. It's an honour and a pleasure. Now, you've heard from the thinkers, the supporters, and the deep thinkers. Now, I'm from the clan of the doers. I'm going to talk about surgical pathway at the Alfred Hospital. So we move on to the next slide. Now, I think Alfred's a wonderful place to work, and it's not just me. It's the second best place according to Newsweek in Australia. And if you want to go to the best place, apparently you have to go to Sydney, but then you've got to drink bad coffee, fight with the traffic. You'll miss out on all the culture, the sports and the cuisine. But the Alfred is great because it's a small hospital on a small footprint, where you can do big things and you can get to know each and every person individually and by name. That's what I like about the Alfred. Next slide, please. Now, junior doctors are well supported at the Alfred. While you might think that it's exciting to be thrown in the deep end and do heroic things, it's actually not fun when you're an intern. There's no nights as an intern. You're well supported. You do day shifts. There's also no rural or regional rotations in surgery. You're able to stay at home while working at the Alfred and have all your support systems in place. Sandringham's the first you go, and that's near the beach. There are some, we are expanding into Bayside Health, and that's a work in progress. But you're able to still remain working at home without having to go to an external regional rotation. And you can enjoy an inner city lifestyle. The cafes, restaurants, sporting events, you have access to the city very easily. You can see those top photos. You can see the Melbourne Arts Centre, numerous events there at the moment. There's a comedy festival just rounded up. Along South Bank, you have all the bars and restaurants you can go to. Now, I'm not downplaying our other networks, but there are some other photos there from left to right. You can see some of the culinary and retail delights of Clayton Road, and then there's the catchment murders in Heidelberg. And in Footscray, that last picture there, you actually don't even have to go into the shops to buy merchandise. So flick to the next slide. Thanks. But on a serious note, I trained in one of those other hospitals in my intern and registrarship years, and then I came to the Alfred for my post-fellowship training, and I've stayed there since, and it's been over a decade. But the first thing I realised when I came to the Alfred is the Alfred has a can-do approach. Whenever you approach someone and ask them to collaborate with you, they're always thinking about how they can help you, and that to me was a fulfilling and refreshing change. It has a full complement of surgical specialties, so you can get a vast experience in every surgical specialty, and through consult services, seeing patients and rotating through them. We have a very large and well-equipped intensive care unit. We have an ECMO service, and we've got numerous quaternary services, and I've just listed a few of the surgical services there. Next slide, please. So our vision in the surgical space is to provide and continue a history of excellence in surgical education and training. We are committed to really delivering the best pre-vocational surgical program in the state, and this is reflected because consistently our trainees that are prepared enter the RACS training programs, and certainly we've been very successful in general surgery over the past 5 to 6 years. We have a 4-prong approach that we've rolled out into each of the specialties, incorporating mentorship and supervision. There's a dedicated pre-vocational supervisor for each subspecialty that will look at your CV, develop your CV, provide research opportunities, provide mentorship and counselling. We have protected teaching time on Tuesdays from 12 to 1, and also internal unit-specific tutorials. We've got simulation skills, and in the last year we've launched a laparoscopic simulation session, which has been hugely popular in the general surgical space, and it runs every 4 weeks, and I think the trainees really have fun on the lap trainers. We also have a strong focus on well-being with a robust mentorship program. Next slide, please. Part of our culture, I think, at the Alfred is that there's the continuity, and like you've heard, many of our speakers have actually come through as juniors. They've done fellowship training, junior training, and they're consultants now. So they understand the system and they understand where you are at now. And in the same vein, we like to retain residents once they get onto programs and then try to get them back as consultants. In short, we strive to look after and retain our doctors. That's a view from my consulting room. It's across the road. So most of us have a strong affinity to the Alfred, even at a senior level. Next slide, thanks. So this is my last slide. You can see our lap training session there, and the guys having a good time. You can also see our Tuesday session where we have a in-person attendance and also quite a strong online attendance. What you can't see there is the back of the room is that all of these sessions are catered with industry, and so you get to rock up, have a bit of time out, learn about something, and also get fed. So thank you very much for your time. I look forward to you guys joining us at the Alfred. If you see me in the corridors, come and say hi and introduce yourself. I'll hand over now to Amy to talk about recruitment.
Thanks, Andrew. For those who joined later and missed the beginning, my name is Amy Tran and I'm a recruitment specialist in the medical workforce unit. So I'll go through some of the key changes to the upcoming PMCV intern match and our recruitment process if you've been allocated to us. So our recruitment team manages all the administrative aspects of medical staff appointments, including end-to-end recruitment, onboarding, employment contracts, credentialing, the coordination of visa sponsorship and APRA medical registration of international medical staff. There are some key changes to look forward to in this year's PMCV intern match, with the main change being that it's now an optimised ballot. Please note that this is only for the Victorian intern allocation VIA groups 1, 2 and 3. It will still be a merit-based algorithm for the VIA group 4 and the Victorian rural preferential allocation. There's also the restructuring of the eligibility groups, which was previously made of 7 categories to now 4 VIA groups. Candidates are required to rank all 27 health services participating in the PMCV match in your exact order of preference. I would suggest that you read the PMCV Intern Information Guide for detailed information on the changes introduced this year. This includes the extenuating circumstances policy and the swap allocation policy. As our intern positions are allocated via PMCV, please ensure that your application is submitted to them. One of the most important dates to note is that the applications close on the 5th of June and only VRPA and VIA Group 4 candidates are required to complete a video interview through PMCV. So this will occur between the 6th and 8th of June. PMCV will then run first round of offers commencing from the 16th of July, where candidates have 48 hours to accept the offer. All Group 1 candidates will be prioritised in the first round, and once these candidates are placed, all remaining positions will be offered to the following groups in sequential order until all positions are filled. As positions arise, PMCV will continue to conduct the matching algorithm throughout each offer period as per the key dates. If you've been allocated to Alfred Health, we'll be in direct contact with you regarding pre-employment checks. So this will involve you applying to an Alfred Health job link so that we can process your appointment, and you'll need to complete and have a clear national police check before we can issue you a contract. So all allocated interns are offered 2-year contracts with the view that most of our interns choose to take up a PGY 2-year with us the following year. If you prefer a 1-year contract, then we can accommodate this, and you can always choose to enter the PMCV match for PGY 2. Once you've been issued your contract and accepted, we'll then send you an onboarding link, which you'll need to complete as soon as you receive this from us so that we can ensure that your IT logins and security pass can be arranged to be ready in time before your orientation, as it will be a peak period for us. Paid intern orientation will commence a week before the official intern year with a comprehensive 5-day orientation program with skills training, shadowing of current interns, and having a real focus on work readiness. Clinical duties will then commence the following week on Monday, 12th of January 2026. Moving on to our frequently asked questions. So how do I guarantee an internship at Alfred Health? The PMCV match is an optimised ballot, so there are no guarantees. You'll have a better chance of being allocated to us by ranking Alfred Health number 1 in your PMCV application if eligible. Mid-year internship positions available. So we don't have a formal process for mid-year positions, as all our positions are allocated by the PMCV for a January commencement date, which is in line with the official intern term dates. However, some positions may become vacant during the year, so please email us. How many positions are available to VIA Group 4 candidates? So we use the PMCV priority system, and so most of our positions are normally filled through the first offer period. However, the number of available positions is just dependent on the PMCV's matching algorithm. Are part-time positions available? Yes, there are flexible working arrangements. If this is something you're interested in, then there is more information available through the PMCV website. If you have any questions that remain unanswered, these can be emailed to us at medicalrecruitment@alfred.org.au. We'll now shortly move on to our virtual Q&A session. The breakout room links can now be accessed in the chat. We ask that you please keep your mic on mute when you enter the chat to avoid any disruptions. Finally, thank you so much for joining our information session, and we hope you found it beneficial. We'll now move into the breakout rooms. Thank you.